Yeah.
Okay, we're now live.
Thank you, Emma. Welcome, everyone. Simon, do you want to present this first one, or are you just listening in? Or is Sarah?
Yeah,
Simon, you're mute, sorry.
Sorry, and after my error in the opposition brief, Sarah, over to you to present these ones.
Okay. Right, Sarah.
Thank you very much. So I'm bringing you two papers today for executive member approval, both of which relate to the spend under the Department for Levelling Up Housing and Communities New Burden Fund for Domestic Abuse. This budget was first available in 21-22 to support local authorities to implement requirements under the new Domestic Abuse Act. The funding is agreed for a year at a time, and Hampshire County Council was allocated 2.3 million for this year. So the first paper is requesting approval for additional spend through the current domestic abuse contract. Domestic abuse services in Hampshire are currently commissioned through Stop Domestic Abuse, a contract which was awarded in 2018 and started in 2019. It's a 5-year contract with an extension with an option to extend for 2 years. The original contract award was 13.4 million, but it was noted at the time that there was expected to be significant additional external grant funding over the lifetime of the contract, and it was intended to channel this through the contracted providers. Up until this financial year, additional spend has taken place, totaling 1.239 million. The New Burdens Fund from the Department of Levelling Up Housing Communities has allocated Hampshire around 2.3 million in April 2021 and a further 2.3 million in April 2022. The funding is agreed on a year-by-year basis with the total allocated amount determined by the spending review. The budget is to enable local authorities to fulfil their duties under the new Domestic Abuse Act, namely the requirements under Part 4, which relate to support within safe accommodation for those experiencing domestic abuse and their children. So with this paper, we are looking for executive member approval to approve further spend through the domestic abuse contract for this financial year 22-23 up to a maximum of 1.5 million. This would enable greater capacity for support delivered through the existing contract, as outlined in the table in the paper. In view of the fund being allocated on a year-by-year basis, we are also requesting executive member approval to delegate authority to the Director of Public Health to approve future additional spends on this contract in consultation with the exec member up to a maximum of the budget provided by DLUC each year. And as mentioned, this year it was 2.3 million.
Thank you, Sarah. Can I just ask you a question? I know that Basingstoke sort of step outside our domestic abusive services. Is that just for accommodation, or is that for delivering services as well? And then
So it's the housing bit that they so through.
It's the housing bit they step outside.
It's not this side. So they're part of this going forward, and we have 3 commissioned refuge places in houses in Basingstoke, and we're linking on the housing side as well.
Okay, thank you. Bill, you're the only other one here who would like to ask a question.
No, I'm very happy with the recommendation to go ahead. I think it's a very worthy and worthwhile cause.
Super, thank you. Jennifer, do you have anything you want to put in? No.
Oh, no, I don't. Sorry, it took me a little while to unmute.
Okay, Dave?
No, this report's gone through finance. We're content with the allocation of funds and the recommendations in this report.
Super. Right. I'm very happy to agree with the recommendations on that. And Sarah, and
Thank
then
you.
we go on to the next one.
Yep.
Yeah,
So I'll take us through the next one that's related to the same fund and budget as well. Thank you. So this paper is to request approval for a proposed grant scheme to support Domestic Abuse Housing Alliance DAHA accreditation. The grant scheme would be available to Tier 2 authorities across Hampshire with the purpose of supporting each authority to become DAHA accredited. DAHA accreditation improves the housing sector's response to domestic abuse through the introduction and adoption of an established set of standards. By doing this, it enhances how housing providers interact with survivors of domestic abuse and strengthens the area's coordinated community response to domestic abuse. Becoming DAHA accredited is quite an involved process and can take up to 2 years. The grant scheme for Tier 2 authorities is proposed to incentivise and support them in this process. It would contribute to annual membership fees, DAHA project support and assessment fees. The amount available to each Tier 2 authority would depend on the number of homes owned or managed, as well as the geographical spread of properties, but the total proposed under this grant scheme would be £226,470 for this financial year. Achieving DAHA accreditation across Hampshire is an intrinsic part of the whole housing approach, as outlined in our domestic abuse safe accommodation strategy. By having this process of awarding grants, it will enable the districts to take over this work area while we maintain an adequate level of oversight and holding them to account. The grant agreement will stipulate service requirements and outcome measures. The grant scheme is proposed to run for 3 years. However, as the funding will be from the Delegate New Burdens Fund, this is only confirmed, as mentioned, for a year at a time. Therefore, our request today is for executive member approval to spend the £226,000 on the first year of the grant scheme, and this will enable us to support a maximum of 6 Tier 2 authorities in the first year. The request is also for executive member approval to delegate authority to the Director of Public Health in consultation with the executive member to approve continuation of the scheme and funding of grant awards for years 2 and 3 of the scheme. And this would be taking into account the funding that is received from DLUC for each of those years, but up to a maximum of £103,965. And just to note that although our plan is to limit the expenditure to 3 years, we would include a requirement to facilitate slippage in the scheme, and therefore the funding might potentially be utilised over a 5-year period, but with the same total overall amount. Thank you.
Super, thank you, Sarah. Have any of our tier 2 authorities already got this accreditation?
Not yet, no. I think we've got about 4 who have expressed an interest in pursuing this, and then we hope that more will come on board as a rolling process.
Okay. Simon, you wanted to come in?
Just wanted to add, whilst we're not a housing provider as the County Council, we're going to kind of join the DAHA accreditation. It costs a very little amount of money, but it feels like that helps us to move forward. So we're doing that as well in line to help our districts and other housing providers to do that.
Good, thank you, Simon. Welcome, Anne. Have you joined us because you've got a burning question to ask on this paper?
Well, I had it in my mind it was 2:30 for some reason, but there was a few questions I wanted to ask.
Feel free.
Because you might think they're daft, but what does contingency for error estimates, and it's for an awful lot of money, what does that mean?
Oh, I think that relates to the first paper. That's
yes,
really,
which I've missed. Sorry.
Yeah, no, sorry. It's really just essentially if any of our amounts in that that we've got it against, if we would just had some error within those in the calculations, it's to try and not limit the amount that we had available to spend if something turned out to be slightly higher. We wanted to ensure that the approval gave us some flexibility in the amounts required.
Okay, thank you. What else did I write down? Target hardening posts.
Yep,
what does that mean?
So target hardening is an overall term which refers to the way that somebody who's experienced domestic abuse, that support can be given to them to enable them to remain in their own home. And target hardening is things that are put in to increase the security of their home. So it might be like, for example, additional locks. It refers to the hardware itself that helps people stay in their own home as opposed to going into a refuge, which is often preferable for those experiencing domestic abuse.
Okay, so it's all good, but I just didn't understand the way they're phrased.
No, sure. It's a strange term.
Yeah, and have we done the Survivor Voice Forum at Hampshire?
It's something we're in the process of starting to set up. So we've written a specification for that, and we'll be looking to externally commission that out. But yeah, it's something that is, we're keen to pursue and get established as soon as we can.
And will we be running it, or will it be run by someone else?
I think that's to be determined. It's something that we would want to set up in co-production with survivors themselves as the best way that is put in place, and to ensure that we can hear the voice of survivors at all different levels of the work that we do.
Okay, thank you. One more question. And I think you were just talking about it. Why has the figures gone from 6 and then it goes down to 2 in the graph that you gave? And I haven't got my other iPad on because I was still sure it was 2:30.
Oh, is this the for
Yeah,
the
it's on the
grant?
one you've just done, and it
Yeah.
starts off with 6 boroughs and then it goes down to 2 twos, and I just wondered why.
Oh, it's just the amount that we have available. So in the first year, we've allocated a greater amount. So the amount each Tier 2 authority could request for under the grant scheme, it depends on the total number of houses that they have and the spread of the property. So a different amount will be available to each of the district areas. And so this, in the first year of the grant scheme, we have a greater budget set aside for it. So we can support more Tier 2 authorities in the first year. But that will be on a rolling basis as they themselves are in a position to pursue the accreditation as well.
Thanks, Sarah. You'll be sorry I came back on
Not
this.
at all.
That's it. Thank you.
Thank you.
Simon.
Councillor Briggs, I just wonder, your questions are absolutely really helpful and really valid. I think on the target hardening, obviously we want to do more to allow people to stay in their own home rather than moving to refuge. And obviously that does require working with both the victim and the perpetrator, and that is quite a complex relationship, including working with the police to put orders in so that people can't get there. I think your point around the survivor voice is really important. What we have learned in our work is that some people, when they've moved on and started their new life, don't want to look back and almost don't want to get involved in service user engagement. So that's quite challenging. And obviously if someone's in the middle of their journey, they're in a place we need to keep them safe, and that's quite trivial. And we also need to think about those people who are perpetrators and how we hear their voice for what would help them change their behaviours. It's quite a complex piece to wrap up together, but we are absolutely committed to making it work.
Thank you, Simon. Thank you.
Right, Bill.
I fully endorse actually this system, and as has previously been said, the more districts we can get on board, I think the better, because the partnership is very critical in the way we operate, and particularly with the housing associations, which we discussed before, to ensure that the money gets to the right place at the right time, and you know, that we ensure that we continue to do it.
Thank you, Bill. Jennifer, you wanted to come in.
I just wanted to pick up on something I think Sarah just said about the grant scheme operating over 5 years. And I just wondered whether you therefore wanted to amend recommendation in para 4 because that says only for 2 years. So I wondered if you wanted to amend that to say grant awards for future years, rather than just limiting it to 23-24 and 24-25.
This relates to the fact that the money's coming in those 2 years, and then we'll be asking districts, Sarah, I think that's right, that we'll allocate the money, but what we're not going to say to them is you have to spend it in that year if it's better for them to roll it over.
Okay, thank you. I wasn't sure I'd understood the reference.
Yeah, and it might concentrate their minds if they think they've got to do it within the next 2 years as well, even though we know they don't have to, but it might just, okay.
And I think this has been one of the missing links in domestic abuse, that housing authorities haven't had that responsibility, and obviously rehousing someone who's experienced domestic abuse is really key for their journey if they need that.
Yeah, yes. Okay, anything else, Jennifer? No? And Dave, you're happy with the money?
I'm happy with the money. Everything's fine on that front. Thank you very much.
Okay, right, Sarah, thank you very much. More than happy to approve. Okay.
Thanks.
Right, now it's the additional spend on the substance misuse treatment centre.
Thank you, Councillor Fairhurst. And since I've done most of the briefings, I said to my colleague I'll carry on doing them, so rather than bring them in. So this first report is around approval to spend linked to a new burdens grant from the Office of Health Improvement and Disparities. And we have done some additional spend previously, so it's the recommendation is about approving additional spend in line with the contract and the funding for up to £2.4 million. And the second recommendation is that you delegate authority to myself in consultation with yourself on an annual basis around the additional funding as it comes down, because we've only got indicative amounts at this point, so we don't know. And then the national funding is really to support the implementation of the National Drugs Strategy from Harm to Hope, in line with the fact we are setting up a new statutory substance use partnership. We've got a number of schemes in the programme to spend, and they are about increasing treatment capacity and the quality of our local treatment services. It's good, but we want to improve that, particularly thinking of those who find it hard to access. Improve the continuity of care from prison to treatment. So we've known previously people coming out of prison then tend to drop off of treatment because obviously they've got a change of circumstance and their life is changing. So we're really improving that, and we have seen a change already over the work we've done in that space. We want to increase the capacity of our residential rehabilitation, and also focus on those people who are more likely to die from drug and alcohol related deaths. So those are kind of themes we're working through to move that forward. It's a positive programme, and we're really pleased to use this new investment to improve outcomes for people with drug and alcohol problems. Happy to take any questions.
Yeah, it's not really a question, Simon. Well, it is a question, and I'm sure you don't know the answer, but you might have a vague idea. There's been a lot in the press about Scotland, or Glasgow in particular, being the drug capital of Europe, and 1,000 people a year dying from drug overuse. Now, actually, the population in Glasgow is pretty similar to Hampshire. How many deaths do you reckon we have due to drug or alcohol misuse?
I don't have that figure to hand, but
No.
I can get it. I think one of the things we need to recognise with deaths from drug and alcohol, as our population ages, so do our drug and alcohol clients. So some people have had a user journey that's lasted many, many years, and these people will be dying younger than their non-drug user counterparts from things like coronary heart disease, liver disease, and other things. So it's how we look after those people. And also, if they withdraw too quickly, that causes trauma in the body, so it's doing it in a safe way. We do unfortunately see some deaths from people at a younger age, and we have a very robust process for monitoring that, looking at any learning and making sure we work together to prevent any deaths. Now, some of those are unique, and there aren't any particular circumstances, as you would think in other deaths. There's things we can do. And one of the things we have done is really work closely with the mental health services, because you'll remember for many years, you can't go to a drug service because you've got a mental health problem. You can't go to a mental health service if you've got a drug problem. We now have some workers across both our Southern Health and our drug services that are making a real difference in that space. For example, training our drug misuse workers in understanding mental health so that they can help them. So those kind of things. But I can certainly get you those figures, maybe at one of our exec member briefings.
Yeah, it was just for interest, really.
Yes.
Because the populations in size are similar, although the living conditions probably aren't.
Indeed.
Okay, thank you. Bill?
I fully support the aims and objectives that Simon has stated. On a recent report about the addiction of vapor, smoking by school children, Simon, has that been included as part of the drug addiction, or is it, something that has to be considered for the future?
So vaping sits under our tobacco control strategy, and you're absolutely right. And we are talking to colleagues, but we take the approach, along with other councils and other public health professionals, that vaping is a tool for quitting, but we are aware, particularly in more recent years, we've seen younger people taking it up as a habit in itself. So we're doing some work, including with vape shops, to work through that and support people and ensure that people don't take up vaping as a new habit, and actually it is used as a quit tool. So you're absolutely right, but that was certainly tobacco control, and our service will help those people.
Yeah, thank you for that. And, full praise for the detox centre and all the staff that have been involved with that. I mean, obviously the sheer numbers demands more centres in the south and southeast. And has there been any sort of scope looking at future sites in the south and southeast?
So should we put that up under the second paper and let me respond to that under the second paper, because that's around the detox unit.
Yeah. Is there an age limit on vaping? I mean, I know there is.
There is supposed
It's
to
18, be 18.
Yeah.
Yeah, but as you may understand that with cigarettes, you use it and it's gone. With vaping, you can find that a younger person will perhaps borrow their parents' vaping equipment, so it's not quite the same. So you're right, you can find it's easier to get hold of, perhaps.
Oh, okay.
Yeah, I think, Liz, one of the main points there is that the normal sort of vape might do up to, let's say, 4 to 6 sessions. But some of the contraband that's coming into the UK from Europe and China, you can go 20 to 30 plus vapes. And I think that's the biggest concern at the moment with school children, is the addiction to that type.
We work very, very closely with trading standards to think about illegal tobacco and all those kind of things. And it's kind of something that's fairly under the radar of the work because it's important that, you know, but it does work really well, and trading standards are absolutely excellent in this space.
Yeah, okay. I just thought it would be more difficult for school children to access this than a packet of cigarettes, but obviously not. So
Swings and roundabouts. Yeah.
Yeah. Okay. Anne.
Yes, fully support. Going back to vaping, there's been a lot of programs on TV with trading standards, and most of the time, I think they did 6 shops, and 2 out of just 6 were selling to underage, and they are getting very, very addictive. So I know it's something we've got to work on. I'm supportive of this, but can I just ask one question? Because I can see Dave's there. Is this all the new money from when we did that task and finish group, and Paul was reassuring us all, because obviously some people were really worried? Is this the new money that's come in for what we were cutting off the other one?
So there's 2. So through the task and finish group, we were looking at savings in the public health grant, but due to the intervention from Public Health England, we amended those savings, and the change we made at that point was just repurposing the treatment centre in Winchester, because as we're all aware, Winchester property can be quite expensive. So we've done that. So we took a small amount of money from the public health savings as agreed by Health Over Scrutiny. This is new money from the government. The government is very clear. What we can't do is substitute this money for money in our public health grant. So we have to submit both. So if this only saw a drop in this amount in our public health return, they'd say you can't do that. So it's new on top of that money. And I'm going to say the work of the new venues in Winchester has gone very well. There was a hepatitis C open day at St Peter's Church in Winchester yesterday, went incredibly well. And you think that's a really interesting partnership, but actually it's working really well, looking at different voluntary spaces.
Yeah. Are we putting it out on the news about how well this is all going for the criticism we got before?
With Jane on the line, we occasionally do press releases, but you're right, I think this is an opportunity with some new money to really show what we're doing and how we're doing it well. So if I can link with Jane afterwards, we can make sure that we get some of that press out. But you're right, sometimes it's a routine, as we've got a routine hum of work, and we don't shout about it enough, but we do tweet and put it on social media.
Okay, thank you.
Just interjecting, yes, so we have actually got a media release plan, so a draft of that will obviously make its way both to you, Simon, and to you, Councillor Fairhurst.
Thank you, Jane. Right, can I just go back to the vaping, because this sort of seems to have passed me by a lot. Maybe it's because I'm a non-smoker anyway. Do children who vape then graduate to smoking, or do they stick with vaping?
They tend to stick with vaping. I think you're right. There's what you're saying is what's the career pathway for a smoker. I think it probably has changed. I think mainly they stick to vaping, but of course, if someone gets addicted to tobacco, it's then sometimes they may change into cigarette smokers. But we have seen consumption of cigarettes falling, and vaping hasn't replaced that. But it's how we continue that. And one of the pieces of work we're doing is how do we move to a place where we are smoke free by 2030, which includes all this. Now, vaping is safer than cigarettes because it has less chemicals in it. It has the nicotine, which is the addictive bit, but it doesn't have all the 3,000 other chemicals. So it's just how we do that. But again, it might be useful if, Council Affairs, we could do something Health and Wellbeing Board to really talk about tobacco and think about how all partners play their part in that space, because you're right, the picture has changed and perhaps we need to update members on how that works.
Yeah, no, that would be good. Thank you, Simon. Right. Bill, are you happy?
Yes, I'm happy with that. I think what you've recommended there is very important. It should be brought up at the Health and Wellbeing Board.
Super, thank you. Okay, very happy with that, Simon. To agree the recommendations. Shall we go on to the Substance Misuse Centre now?
Yes, so this decision paper is for funding for the Drug and Alcohol Inpatient Detoxification Unit, and very pleased that Councillor Withers has come to the opening. This is working with colleagues across 18 other authorities in the South East and South West to come together to use our limited funding to bring forward a centre for the South East, as I think Councillor Withers mentioned. So there's currently a centre we've opened in Fareham, there's one in Kent and one in Weston-super-Mare. So bringing that together has really been helpful. So this is a decision to approve the spend of up to 6 million over 5 years for the inpatient unit, bringing together the money that Hampshire has alongside money from the other authorities. So we get all that from Office of Health Improvement and Disparities. It's worth noting I've approved interim measures to make sure we are in line with procurement and regulation. So that's currently running through December. And then the recommendation to delegate further authority to myself around the spend and the arrangements for the service commissioning, because like the other money, we have got indicative amounts, not confirmed amounts, which does cause us a slight challenge, but we are working in that space. The government, in my mind, quite rightly, wants to increase rehabilitation. It's effective and it works, and you're generally in the inpatient unit for a couple of weeks. You have a lot of preparation, so someone doesn't just go there, they're given a lot of behaviour because it's a change of lifestyle. And then you are transferred very safely back to your local service, wherever that might be, to carry on your journey to be a drug or alcohol-free life. I think it's a brilliant innovation we've done locally, and really pleased to recommend these recommendations to you.
Super, yes, Simon, I think you're right. I think it's a brilliant. We will have the figures for Hampshire patients who go into the detox unit and come out and continue the journey, if you like, and end up drug free.
Correct.
Do we ever get any feedback from the other authorities about how successful they are?
So because we are the commissioner, we will get both. So we'll get the number of people coming out, and they'll be followed up. So yes, we'll get much more accurate figures for Hampshire and from allowed to say and for the Isle of Wight in my role, so we can see how it's working. And I have to say, I think, as I said before, it's a really brilliant centre. I don't know if Councillor Withers wants to comment. It feels like a safe home with the right clinical aspects to want someone to detox and come out, and I think that will make a difference to people's lives, and then their ability to contribute to society.
Do you have a waiting list now? I mean, what's the capacity? Is the capacity running at 95% or 80% or? I
think it's about 80% at the minute, going up all the time. I think as people get used to the fact there's a new centre, it takes a little bit of time to embed, particularly for those people not so local, because obviously if you live in Oxford, yes, that journey is better than Weston-super-Mare, but you still got to kind of do that. So I have recommended to the unit that we hold one of the regional meetings in Fareham, so that those commissioners and providers can really understand how it's working, but they're still committed to the funding. So
yeah, no, that would be good to get them all down here. Yeah. Okay, Bill, I know you've been to the unit. Do you have any questions, or are you just happy?
No, very happy with the progress that Simon stated there, and I was very impressed with the facilities, and more people that use it out of the 18 districts, the better. It was a great win for Hampshire in all the hard work that they did to get the detox centre.
Thank you. Anne.
Yeah, also very happy. Thinks it's a brilliant idea. My only question, and I've got to have one, I know, is that when I read all the lists of all the counties, districts, people can only go there from, say, a district if they've paid enough money. Is that how people can send them? That's the way I read it. So if you're only, say, running at 80%, if I say Oxford then hasn't given in enough money to send another person down, how does it work?
So I might not ask the question right that way, Councillor Briggs, but each authority has an allocation for residential detox. Across, as you say, Oxford, Hampshire, Isle of Wight, Southampton, Portsmouth. We all put all of that money in. So if Hampshire doesn't use all its places, as it were, we don't get a refund. So, however, there is an opportunity if, you know, we want to use the beds. So we just kind of use that and manage that and make sure the demand meets the need. And of course, that becomes a waiting list as more people get there. So there's not a kind of you have to pay for your place because each authority is paid to put its money in. What people could do is spot purchase more places. I've got with relevant space. So they may say, well, actually, I've had 10 people this year. That was my allocation. I want to put some more in. So that's how it works. And our locally Inclusion run our community treatment service. They that feels wrong. They support the people to get ready. And they would say, right, these people are more ready than someone else. So they kind of work people up ready for the place. And you would book a place in advance. So you think, well, this person is going to be ready in September. So I'll get them ready now, because you can't just say you're going tomorrow, because they'll have lives to sort out.
Okay, thank you, Simon. Thank you, Liz.
Okay. Right, Simon, thank you very much. Let's hope it goes from strength to strength. And let's hope they continue putting the money in.
Yes.
Yeah.
Thank you very much.
Absolutely, thank you. Right. Is it Meals on Wheels now? Am I on the right place? Is Gillian here, or are you doing this, Sarah?
It's Stephen today.
Stephen. Oh, hello,
Yes.
Stephen. Yeah, sorry, I just saw you come on. Yeah. Right. Do you want to go on ahead?
Great, thank you. Thank you very much, Councillor. So, the purpose of this report is seeking approval to the spend of 30 million over a maximum of 10-year period on a service contract for the Meals on Wheels service to commence from the 1st of October 23. So to give a bit of context, this service primarily delivers hot 2-course lunchtime meals. The meals cater for specialty diets and requirements if necessary, and meals can be plated up and cut up as needed. In addition, the drivers are also trained to carry out wellbeing checks whilst delivering the meal and ensure that clients have things like access to drinks and maintain hydration, and report issues back to Hampshire County Council if they have any particular concerns. Currently, each customer pays about £5.67 for a 2-course lunchtime meal and £3.25 for a tea time pack. There are about 1,300 active customers receiving a meal on Wheels at any given time, and it's just over 30,000 lunchtime meals are delivered each month. Meals on Wheels service contributes to supporting people to live independently in their own homes, maintain that independence, remain part of the community. The inclusion of the welfare checks also helps to ensure that well-being and safety concerns are identified and actions can be taken in a timely way. The current service resulted in the council subsidising the cost of the meal on a sliding scale, with our contributions reducing year on year. As of April this year, the service reached a cost-neutral basis with no further subsidy payable from the County Council. Therefore, it was considered that a continuation of that arrangement best meets those key requirements, and subject to this decision, we'll look to tender the opportunity on that basis. So in terms of how the financial arrangements work, the County Council would be responsible for the full cost and delivery of the contract. However, a provider acts as an agent for the County Council. They collect the cost of the meal from the customer on our behalf. The customers pay the provider the full cost of the meal, but net of any VAT. VAT charges are then claimed by the provider from Hampshire County Council, who in turn recover that VAT from HMRC. That enables the cost of the meal to stay affordable as affordable as possible for the customer. Largely results in a sort of zero-sum position for the County Council, whilst keeping it affordable for that end user. under the terms of the new contract, in addition to the provider being responsible for the collection of any income, we'll also ensure that the provider is responsible for ensuring that they have a robust debt recovery process in place as well. It would be our expectation that the service would have a positive impact on those who are using it. It ensured continued provision of a valued service to those who are over 55, as well as younger adults who have dementia, disability, mental health and substance misuse issues, which includes meeting the needs of any special dietary requirements due to health concerns or conditions. Likewise, any customers with specific religious requirements or beliefs also provided with appropriate meals. So it's a by way of a quick summary for me to say, just to confirm, the paper's seeking approval to spend up to 30 million, which is the inclusive of that position, over a maximum 10-year period on a service contract for Meals on Wheels commencing from 1st of October. I'll open up to questions.
Thank you, Stephen. I have no questions. I think this is a superb service. I think trigger training the drivers is brilliant. Debt recovery, how much is the debt running at per year of non-payers? I don't think it's very much, is it?
It's not huge. I haven't got the numbers directly in front of me, but I can certainly come back with them. It's not a huge amount. But to say that most of the debt is managed and recovered by the provider. As they are working on our behalf, there is a financial risk that any debt that can't be recovered would fall to us, but it's minimal.
Yeah, that's what I thought. No, absolutely fine. Anne.
Thank you. No, it's a great service. It's good to hear that we're cost neutral now. I think that's quite amazing, actually. I think you've done really well with that, because it was costing a lot of money at one time. The only thing that I was curious about, I wrote the figures down. It was 567 for your lunch and 325. So how many people have both delivered? Because it's nearly £9 a day. I just wondered.
Yeah, the majority have just the lunchtime delivery. There's a smaller percentage do have both, but it's an option that they can choose to take up if they want to. As I say, the majority of that, and it is worth saying that's the current position. Obviously, the exact numbers will be subject to sort of the tender outcome as well.
Yeah, no, it's such a good idea, because the person is checked on by the driver, and so many different meals can be done for people of different beliefs. So yeah, it's great all round. Thank you.
Bill.
No, I think Anne's right. I think most people, when they get older, they only have the one meal a day, and it tends to be the lunch meal, and have a lighter meal in the evening. Certainly in the residential home that I've visited, they all disappear to their rooms in the afternoon with their sandwiches and everything to watch their favourite programme. So lunch is a key meal. And it's such important with the population in Hampshire getting older. I think we've said about 5% over the next 5 years of 75 plus. The numbers are going to increase. So this service is critical to ensure that all those people that need it get covered.
Yeah, and actually the afternoon tea they give, because I was in someone's house once when they had it, actually quite nice, actually. I'd have said it was better than the lunch, but never mind. They're Wiltshire farm foods under a different name, Appetito. So if you've ever had, other people seem to buy Wiltshire farm foods, don't they? Actually, they're just getting Appetito, just rebranded. So.
It's not a huge market for providers in this area, which is not surprising. It's a huge sort of logistical operation to prepare and transport and manage that. Yeah, as I say, the two big ones, Appetito and Wiltshire Farm Food, are actually the same organisation. Yeah.
Yeah. Okay. Thank you, Steve. Jennifer, are you happy?
No comments from me, thank you.
No, good. And Dave?
No comments from me, thank you.
You're happy if there's non-debt that we cover it, because it is only a few thousand a year, isn't it, the non-payment?
To be fair, it's the only way the contract as it stands can work, so that we can facilitate the VAT and paying the VAT. So we have to take responsibility, accept responsibility for the debt, and it's a relatively low risk compared to the alternative of making clients pay VAT.
Yeah, absolutely. Okay, thank you. Very happy then. Thank you, Stephen.
Thank you very much.
Thank you. Right, then who's doing the, oh, is Peter here to do the grants?
I am, Councillor Fairhurst.
Right. Hello, Peter. Right, do you want to go?
Thank you. So this report is seeking approval by yourself for to award 6 grants totaling £131,509 to cover a range of time periods between the 1st of August and the 31st of December 2023 as part of the Local Solution Fund as detailed in the appendix of the report for those 6 different projects. The Local Solutions Grant is a grant which we continue to award, which is seeking to provide services on a locality basis within those communities, increasing the reach and access to early prevention support to decrease the demand and also the likelihood of someone coming into adult social care. All these applications are awarded one time, and they will not be given a second grant. That is made clear to all organisations as part of the application process. And as part of this application process, we have officers who work with the organisations to make sure that the grant application meets the needs of both the local area by demographics, as well as the needs of our adult social care teams and other local resources which can aid that prevention work. In terms of the funding, as I said, that figure of 131,509 for up to 2 years is budgeted out of the one-off resources already available, and subject to approval, the total grants committed for payment will remain within the agreed annual budget envelope for demand and prevention programme. As part of the performance, as I said already, an officer will work with in terms of that application going in, and that officer on the whole, unless they will remain with that organisation to support and make sure they deliver on that performance throughout the grant, as well as making sure they seek every opportunity to build their sustainability in that long term, recognising that this is only one-off funding. We also, within that period, have a number of mechanisms set up to ensure that projects are effectively evaluated, so we can learn from any benefits which may then be used to inform further business cases which may develop additional early intervention prevention services. In terms of the award, as well as it being clear that this is only a one-off grant and the officers maintaining that, in terms of the grant agreement, all organisations sign a grant declaration within that agreement, but they accept this award as for the given period, and no commitment exists from the County Council to continue funding after this time. Thank you.
Yes, that does help, Peter, if they actually sign saying they understand this, but when they come back saying, oh no, we didn't think that was going to happen. Can I just ask about this one in Basingstoke about doing a sort of handyman service?
Yes.
I know in other districts they've set up something, and there was a charity called the Shore Trust that used to do it as well. But they all charged old age pensioners an absolute fortune. So the old age pensioners stopped using them. I mean, I say an absolute fortune, but it was something like £15 an hour for a gardener. And yet, you know, so by the end of the day, they owed them over £60 for the amount of work they've done in the garden. Do we actually say to them, you know, A, are you charging for this? And if they're charging, is it a reasonable charge?
So in terms of the charge, yes, I believe there is due to be a small charge for it, so it's less than the £15. Part of that reason is so they can continue to sustain that service beyond the life of the grant, which is what we're seeking them to do. But equally, within the term of the grant, it shouldn't be a prevention from someone accessing that support, if that makes sense. Yeah. In terms of the whole handyman services, yes, there are others out there within the county council area, including the Shore Trust. However, not all of those organisations operate in every area, and we'll identify that in terms of Basingstoke and Dean area, there was actually there was an actual need for this service to be there because there's not currently a provider of this service. Hence, that's why there's a grant seeking to set up one of these services in that area.
Oh yeah, I think it's a brilliant idea. I know in one of the parishes in Eastleigh, they do it, but they just put the type on the pallet. You know, they put a precept on the parish funds, and that pays for it. which you know, not everybody has parishes, of course. So anyway, sorry, Anne.
No problems with it at all, but I would just like to comment on how it's now set up. It's, I think, going to save us all an awful lot of problems in the future when people can't put in the paper or complain about us not carrying on with their grant. So, and to have an officer there when they do the grant scheme. So I really approve of the way you've set it up now. I think it's going to make it much clearer for them and save Hampshire an awful lot of bother. So yes, thank you, Peter. I think it's really good.
Thank you.
Before I come to you, Bill, Peter, I know you do an evaluation to make sure it's carrying out its original aims. Could you bring me a copy of the evaluation once you've got them? Just so
Yes, that's no problem at all. We can do that. And we've got existing projects, as you're aware, under which you've recommended the approval of and the award under this fund, so we can make sure they're available for you as well.
Super, that would be great. Thanks, Peter. Bill, sorry, Bill, I can't see you. Yeah.
No, I think the points that both Anne and yourself, Liz, have made are critical. Getting the message out to the people outside that it is for 1 year and it's fundamentally for that specific support is very important. The press don't always get it right, and we've seen that recently, and they always point the finger. So the earlier we can get out with the correct description of exactly what the service is and how it's supported by the county is critical to its success. We all know that people will moan because they won't get it for the second year, but as much publicity as we can get, is very important.
Yeah. Right. Well, Jane, I think that's over to you then, isn't it?
Yes, it is. Thank you. Duly noted.
Good. Okay. Thank you very much, Peter. So actually, I was going to say, Jane, every press release, you have to keep repeating 1 year only, 1 year only.
Yes, I will do. Yes. And we have a press release being drafted as we speak, actually, by a colleague of mine. I'm tasked with doing it. Peter, I think you've already had a chat with him today. So again, that should be ready fairly shortly for you to review, Councillor Fairhurst. Okay,
thank you, Jane. Right, thank you, Peter. More than happy to agree. Okay.
Thank you.
Right, I think that's it, everyone. Thank you all very much. Thank you. Have a lovely weekend.
Thank you.
Enjoy your
Thank
weather.
you all. Yep.
Yeah. Okay.
Thank you. Thank you, Liz.
Goodbye.
Bye.
Bye.